often asked these common questions about having a swollen eyelid. How do you treat it? What can cause your upper eyelid to swell up? How long should a swollen eyelid last? And there are several easy solutions to a common swollen eyelid. However, there is important information you must understand, and most importantly, you must know when it's time to go to the doctor to keep your eyes healthy. So all of that in today's video, let's get into it. Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so that you can have healthy, beautiful, comfortable eyes. If you're new here, give a little love tap on that subscribe button to stay up to date with all of the latest eye tips and tricks I have for you. So what is a swollen eyelid? A swollen eyelid happens when fluid collects in the tissues around your eyes. You can also have itching or pain. Now, what are the causes of a swollen eyelid? So a swollen eyelid is often a symptom of another medical condition, including things like allergies, a bug bite, fluid retention in general. You can have inflamed eyelids due to blepharitis or otherwise. You can have pink eye or conjunctivitis, trauma or injury that's often accompanied by a discoloration, lack of sleep. Shingles can even cause a swollen eyelid. You can have a clogged oil gland in your eyelid like a chalazion, or an actual eyelid infection like a stye or preseptal cellulitis. You can even have a more deep eye infection, an infection around the eye socket called orbital cellulitis, or you could have a swollen lid from a thyroid condition like Graves' disease. So how do you treat a swollen eyelid? Well, what is it from is probably the biggest question. Treatment depends on the cause entirely. If you have an infection that's causing the swelling, you may need to use antibiotic eye drops, ointment, or cream to help clear up your symptoms. If that doesn't help, your doctor might also give you antibiotics to take orally by mouth. In the case of orbital cellulitis, sometimes you even have to have IV antibiotics to help with the infection. You might also have to take steroid medication depending on the cause of the swelling. You can also reduce the swelling by cooling and moving the fluid away from the eyes. So to ease your symptoms, take care of your eyes, keep the area around them nice and clean, and put a clean, wet cloth on your eyes twice a day for 15 minutes at a time to loosen crust from your lashes and help get rid of extra oil that might be plugging up your glands. Now, the question with the compress is, do I use a hot compress or a cool compress? And again, this sort of depends on the cause of the swelling. If you have a lot of itching and the swelling is really due to allergies, you're going to benefit a little bit more from a cool compress. The same with an infection. If you have lots of inflammation in the area from like a conjunctivitis, you're going to feel so much better with a cool compress than hot. Compresses are a great idea, but whether you're using hot or cold, depending on your particular eyelid swelling issue, it's also really important to keep the eyelid area really clean, gently washing the area, and I recommend using eye-safe washes. Definitely not baby shampoo and water. I'll link my video above where I talk about why not to use baby shampoo and water, but I want you to use an eye doctor approved wipe like Optase or OcuSoft or the Hydrate brand. The We Love Eyes brand is a good one as well. There's plenty of them. I'll link lots of them below, but you want to use one of those washes on your lids and then rinse really well after. While your lids are swollen, it's also important to give your eyes a rest. So until your symptoms get better, don't wear eye makeup or contact lenses. Use over-the-counter eye drops, artificial tears, to keep your eyes moist. I will often tell patients with active viral conjunctivitis or other eye issues that when your eyes are feeling just really irritated and cruddy, it can be very helpful to use an artificial tear as well as a cool compress to just kind of soothe the eye. Antihistamine drops can also help with allergies if you have a lot of pooling and swelling from allergies, and a cool compress is always going to help with swelling. You could do cucumber slices or tea bags or around the eye, like little eye mask type things as well, but just be careful with, the contents, and if there's perfume in the, or lots of different ingredients. We really want to keep everything you're putting around your eyes when they're swollen, you want to keep it from being perfumed or having a lot of preservatives in it. You can also kind of gently tap or massage the area to stimulate blood flow. You can apply witch hazel to the area or even use a facial massage. So how long should a swollen eyelid last, and when should you see a doctor? A swollen or puffy eyelid is common. In many cases, the swelling will go away within a day. If it's just swelling from allergies, you can reduce that swelling with compresses. But how you treat a swollen eyelid also depends on its cause. If you think there's an underlying infection, a medical condition, then you definitely need to see a doctor. There are things like Graves' disease and in rare cases even eye cancers that it can occur that cause lid swelling. To avoid complications, see an eye care professional if the swelling lasts longer than about 24 to 48 hours. If you've made it this far and you're not already subscribed to my channel, please hit that button in the bell so that you don't miss notifications. That's going to be it for today's iSchool. Class is dismissed.